yes, in this section we'll be talking about the muscles of the eye. Before we go into the muscle proper, let's talk about the contents of the orbit. Now, inside the orbit we have the eyeball. This eyeball occupies approximately 1/3 of the volume. Then we have fascia, that is orbital and the bulbar fascia. We have the muscles. We have the vessels. In that we have the ophthalmic artery. Then we have the ophthalmic veins. These ophthalmic veins are superior and inferior ophthalmic veins. And other than that we have lymphatics. The nerves that enter the orbit are the second nerve, that is the optic, the third nerve oculomotor, the fourth trochlear, the sixth abducen, and the branches of ophthalmic and the maxillary nerve. So the optic nerve goes inside the eyeball and is responsible for the vision, while this oculomotor, trochlear and abducen, that is the third, fourth and sixth nerve, they supply the voluntary muscles of the eye, while the ophthalmic and the maxillary nerve, which are the branches of fifth nerve, that is the trigeminal nerve, they give the sensory supply to the orbit. Other than that we have the sympathetic nerve entering the orbit. Other than all these, we also have the lacrimal gland and the orbital fat. Let's see some of the dimensions of the orbital cavity. In that we have the horizontal entrance width. Now when we say horizontal entrance width, we are talking about this width. This horizontal entrance width is 40 millimeters, while the vertical entrance height is 35 millimeters. When we consider the volume of the whole orbital cavity, it is 30 cc, and the orbital depth, we measure the orbital depth from the rim to the optic strut. So this depth is 45 to 55 millimeters, while the distance from the back of the globe to the optic foramen, that is from here to the optic foramen, is 18 millimeters. These are some of the values that may be important source of MCQs. Now let's talk about the axis of the eyeball and axis of the orbit. So there are two axes we need to consider. One is the axis passing through the eyeball, that is from the anterior and the posterior pole of the eyeball. This axis is called as visual axis. While we have an axis that passes from the apex to the center of the orbit, this axis is called as orbital axis. Now this visual axis, that is the axis of the eyeball, it makes an angle with the orbital axis. So your orbital axis and visual axis, they make an angle of approximately 20 to 25, and the average is 22.5 degrees. Other points that are to be noted in this slide is, if you notice, these are the lateral wall of the orbit, and this lateral wall and the lateral wall of the other side, they are making an angle of 90 degrees with each other, and the distance between the two medial walls is approximately 22 millimeters. So these are certain information over here which could be possible source of MCQs. So let's just see them once again. So we have a visual axis here that makes an angle of 22.5 degrees with the orbital axis here. The lateral walls, they make an angle of 90 degrees with each other, while the medial wall, they are separated by each other by a distance of 22 millimeters, and they are parallel to each other. Next we'll be talking about the fascia, that is the orbital fascia and the bulbar fascia. Let's first talk about the orbital fascia. Orbital fascia forms a periosteum of the bony orbits. Now if you notice in this diagram, this fascia that lines the bone of the orbit is your orbital fascia, and due to the loose connection to the bone, this fascia, this periosteum, can be easily stripped off. This point is in contrast with the other periosteums in the body which are very firmly attached to the bone, but this periosteum of the orbit, that is the orbital fascia, is loosely attached to the bone, and it is also continuous with the dura mater. Now if you see here, it will be continuous with the dura mater, and the sheath of the optic nerve. Now, if we notice the orbital fascia in the floor of the orbit, it forms a gap. It forms a gap here in the region of inferior orbital fissure. And this gap is bridged by a connective tissue with some smooth muscle fibers in it, and these fibers are called as orbitalis muscle. So if you notice the location of the orbitalis muscle, this muscle bridges the gap, bridges the inferior orbital fissure in the floor of the orbit. The orbital fascia forms the extension into the upper eyelid and the lower eyelid, and these extensions are called as orbital septum. Other than that, it also holds the fibrous pulley of the tendon of the superior oblique muscle in its place, and it also forms a lacrimal fascia. Now, lacrimal gland lies in a groove. This orbital fascia, it bridges the lacrimal groove and forms a space where the lacrimal gland sits. So that is the lacrimal fascia. Then we talk about the bulbar fascia. Now, bulbar fascia or the Tennant's capsule, it forms a thin, loose, membranous sheet around the eyeball. Now, if you notice in here, this was our orbital fascia. Now, when we say bulbar fascia, this thing that lines the eyeball is the bulbar fascia. Now, bulbar fascia, it comes from the optic canal over here, lines the optic sheath, and continues here till the sclerocorneal junction. So this is the cornea, this is the sclera, and the bulbar fascia extends till the sclerocorneal junction. The gap between the bulbar fascia and the eyeball allows the eyeball to move within this fascia freely. This sheath gives a number of expansions. It forms the tubular sheath that covers each orbital muscles. By getting thickened, it forms a medial check ligament, the lateral check ligament, and it also forms a suspensory ligament of Lockwood that keeps the eyeball in place. So we can notice that in this diagram over here. So this is the bulbar fascia forming the sheath around the orbital muscle. This is the thickening of the bulbar fascia that forms the lateral check ligament and the medial check ligament. Further, here the bulbar fascia forms the suspensory ligament of the eye. So next we'll be talking about the muscles of the orbit. These muscles of the orbit can be divided into the voluntary muscles and the involuntary muscles. Under voluntary muscles, we have the four recti muscle, that is the superior, inferior, medial and lateral rectus. We have the two obliqui muscle, that is the superior and inferior oblique, and we have one levator palpebrae superioris. So in total we have 7 voluntary muscles in the orbit. When we talk about the involuntary muscle, we have the tarsal muscles, that is the superior and the inferior tarsal, and we have the orbitalis muscle, which we had been talking about when we discussed orbital fascia. With this we move on to the origin of these muscles. So in this diagram we can see the origin of the rectus muscle. All the recti, that is superior, inferior, lateral and medial, originate from the tendinous ring that surrounds the optic canal. So we can see the origin of all the recti muscles over here. But if we notice the lateral rectus muscle, this one, it has an additional head, that is a small tendinous head that arises from the surface of the greater wing of the sphenoid bone. So herein we have the greater wing of the sphenoid bone that gives one additional small tendinous head for the lateral rectus. An important MCQ. So we can notice from the tendinous ring we have just the attachment to the recti muscles. The remaining 3 muscles, that is the 2 obliqui and 1 levator palpebrae superioris, do not arise from this tendinous ring. Now in this diagram we can see the origin of the levator palpebrae superioris muscle. So this is levator palpebrae superioris muscle that arises from the orbital surface of lesser wing of the sphenoid. So we had seen the greater wing of the sphenoid over here, and on the other side of the superior orbital fissure we have the lesser wing of the sphenoid bone over here, from where we have the origin for levator palpebrae superioris, and this origin is situated anterosuperior to the optic canal. So we can appreciate the position over here. So this is levator palpebrae superioris. Then we have the superior oblique muscle. This superior oblique muscle arises from the body of the sphenoid and its position is superior-medial to the optic canal. We can see origin of the superior oblique muscle over here. That is a little bit superior-medial to the optic canal. So superior oblique does not arise from the tendinous ring. But in this diagram, which is the representative of the area near the apex of the orbit, we cannot see the origin of the inferior oblique muscle, because the inferior oblique muscle arises from the orbital surface of maxilla lateral to the lacrimal groove. So we can see it here. We can see the attachment of inferior oblique muscle over here. So this is the lacrimal groove. Just lateral to the lacrimal groove we have the attachment for the inferior oblique muscle, and it is situated near the anterior margin of the orbit. So in the diagram, in the previous diagram which was of this zone, we could not see the attachment of inferior oblique muscle, which is situated near the anterior margin of the orbit. So we have a lot of MCQs on the origin of the muscles, the voluntary muscles of the orbit. In this diagram we can see the insertion of all the muscles, but before we go into the insertion, let's notice the origin of inferior oblique once again over here. So we can see the inferior oblique originates from the anterior rim, from the orbital surface of the maxilla. So with this we come on to the insertion. So we'll see all the recti muscles, they come straight on and get inserted into the sclera. We can also see it in this diagram. And since the insertion is straight down from the apex onto the sclera, they move the orbit in their respective direction. So for example, superior rectus will move it upwards, medial rectus will move it medially, inferior and lateral rectus all move in their respective direction. Now when we see the superior oblique muscle, we can notice superior oblique muscle over here. It comes, then it goes through the trochlear pulley, goes underneath the superior rectus to get inserted into the sclera. We can see it again in this diagram. This is the superior oblique that comes, goes through the pulley, goes underneath the superior rectus, that is between the superior rectus and the eyeball, and gets inserted into the sclera. The insertion is between the insertion of superior rectus and the lateral rectus. Now if we notice the inferior oblique muscle, the inferior oblique goes outside the inferior rectus and gets inserted very close to the insertion of the superior rectus. So based on their insertion, the superior oblique brings about this movement, that is the inward rotation, that is called as intorsion, while the inferior oblique brings about this movement, that is called as extorsion. This diagram highlights the position, the insertion of the superior oblique and inferior oblique very clearly. Now if we talk about the nerve supply to these muscles, it's a simple statement that makes you remember the nerve supply of the muscles of the eye. All the muscles of the eye are supplied by third nerve except SO4 and LR6. When we say SO4, that is superior oblique, is supplied by the fourth nerve, that is the trochlear nerve, and the lateral rectus is supplied by the sixth nerve, that is the abducens nerve. In this diagram, we'll be talking about the movement of the eye. When we talk about the movement of the eye, it is not advisable to solve any MCQ related to the movement of the eye without drawing this diagram. This diagram makes it very easy for us to remember the movements and the muscle involved in these movements. So let's first know how to draw this diagram in sequence. First we'll start with drawing of the eyeball, and then we draw these arrows, these right angle arrows. Once we are done with drawing these arrows, we draw one more arrow over here. Now let's talk about the labeling. Once we have this diagram ready, the labeling starts from the left side. So when we are drawing the diagram, our left becomes lateral rectus. Once we've labeled the lateral rectus, it's very easy for us to label all the other things. We make it medial rectus here. And on the medial rectus side, we make superior rectus and inferior rectus. On the opposite side of it, here we have two empty spaces, so we just inverse this. So we make inferior oblique here and we make superior oblique here. Once this labeling is done, we make two more arrows, both directing upwards. This makes it once the diagram is ready, it's very easy to know the movement. Now we have to talk about the medial rotation. When we say medial rotation, obviously it's towards the medial rectus. Now we see three arrows here causing medial rotation. So medial rotation is caused by the medial rectus, the superior rectus and the inferior rectus. The lateral rotation is caused by three arrows. So it is the lateral rectus, the inferior oblique and the superior oblique. Upward rotation is caused by two arrows, that is the superior rectus and inferior oblique, while the downward rotation is caused by two arrows, that is the inferior rectus and the superior oblique. While these two yellow arrows, they tell about intorsion and extorsion. Now it's very easy when we say intorsion. Intorsion is towards the inner corner of the eye, that makes it towards this side of the medial rectus. So this side is intorsion and the other side is extorsion. So this arrow will make intorsion, that is caused by the superior rectus and the superior oblique, while this arrow is extorsion caused by inferior oblique and inferior rectus. Now with this diagram we can answer any combination of question. For example, if the question is asked about what movement does inferior oblique brings about, so we all very well know, we can see in this zone the inferior oblique has these three arrows associated with it. So inferior oblique brings about the lateral rotation, it brings about the superior rotation over here, and it brings about the extorsion. So in this way we can answer any combination of questions by understanding this diagram. It's a very important diagram and very common source of MCQ. So let me repeat this diagram over here. So we have to draw a circle, then we draw these right angle arrows. This arrow missing over here. I would suggest drawing these arrows on this side. Now when we talk about the labeling, we start from the left side, left L for lateral, and we make it lateral rectus. Once we have the lateral rectus labeled, we can obviously label the medial rectus on the other side, superior and inferior rectus just above and below the medial rectus. Then on the other side we have to label the oblique in the two remaining spaces, so we just switch them. So superior oblique goes down and the inferior oblique goes up. Then we make these two orange arrows, both directing upwards. Once this is done, our diagram is ready. So now we'll see the medial rotation. These three arrows is caused by the medial rectus, the superior rectus and the inferior rectus. The lateral rotation is caused by the lateral rectus, the inferior oblique and the superior oblique. The upward rotation caused by the superior rectus and the inferior oblique. The downward rotation caused by the inferior rectus and the superior oblique. Please notice I'm not saying anything that I remember. I'm just reading the diagram, and that's the trick over here. If you draw the diagram, you need not remember. You just have to know the way to draw the diagram, and that's it. Okay, so when we talk about the intorsion, it's superior oblique and the superior rectus, and when we talk about the extorsion, it's inferior rectus and the inferior oblique. Hope that makes it clear. With this I move on. The medial rotation is, that is the inward rotation, it is also called as adduction of the eye, while the lateral rotation is also called as abduction of the eye. So your question may ask you about the abduction and adduction rather than calling it as medial rotation or lateral rotation. So that shouldn't confuse you. So with this we summarize the movements of the eye. So with this we complete the muscles of the eye, the movement of the eye, their nerve supply, and we have also seen a bit about the orbital and the bulbar fascia. The vessels of the eye, the details of the nerves associated with the eye, their path is covered in the respective sections of the video. Thank you.